Hello, my name is Dr. Jones. Nice to meet you. Please get nice and comfortable. Today we're here just to conduct a very basic, very simple eye examination, and that's mostly for me to just get a gauge on the state of your eye health. If I detect any problems today, then we may need to book in a more detailed eye examination in the future. I may even refer you to a specialist, an optometrist, something like that. We'll see what happens today and what sort of results we'll get, but absolutely nothing to worry about. Today's session should be quite nice and relaxing, should be very easy. I'll be giving you some simple instructions to follow, and yeah, you just do your best. I'll make some notes as we go along. But first of all, could I get some basic information from you, please? So, could you spell out your full name for me, please? Okay, and could you tell me your date of birth, please? And what is your current address? Okay, excellent, thank you. Now I would just like to ask you a few simple questions just to get a little bit of background about you and your eye health in particular. So first question is, does your family have any history of eye problems, anything at all? Okay, and they have to wear glasses for that. Okay, do you know if they are long or short-sighted? Okay. And the next question is, have you experienced any trouble with your vision recently? In particular, are you having difficulty seeing things far away, or are you perhaps having difficulty reading things up close? And you would say that's only started to happen recently, is it? So what sort of time period on that? Okay. Okay, thank you. And my next follow-up question to that is, do you use computers very often? What is your occupation, if you don't mind me asking? And do you find yourself looking at screens often during that, yeah? Okay. And final question before we actually get into the eye exam today. Have you started to experience any headaches recently, perhaps in particular around the eyes or just behind the eyes? Okay, thank you very much for all that information. Very helpful to me indeed. It's going to help me a lot today as I'm testing your eyes, okay? So what I'm going to do next is I'm going to pop on some latex gloves. You don't have a latex allergy, do you? No, that's excellent, thank you. And to begin with, I'm actually just going to first look around this area here, your temples, I'm going to be coming up close and touching you, and I'm going to be seeing if you experience any pain or discomfort when I touch particular areas. I'm going to also be looking for involuntary twitching or muscle spasming. That may tell me something. So is it okay for me to come up close and to touch your face and everything? Yeah, all okay. Thank you very much. I'll just be a moment as I pop on my gloves now. Sorry, it always takes me a little bit of time just to get my clothes on nice. Okay, so I'm just going to be coming in now a little bit closer to you, and I'm going to be feeling around your eyes, just feeling around your forehead at the moment, and I'm going to be moving along to your temple areas. And during this, I just want you to let me know if you can, if you feel any periods of discomfort or pain. Okay, so not feeling anything at the moment, nothing bad now. Excellent, that's a good sign. Okay, yeah, I'm very happy with everything I'm seeing there. Your muscles are responding as I would expect them to, and you say you didn't feel any pain or discomfort during that, did you? There we go then, that's absolutely perfect start. So now I'm going to be using this eye chart. I'm sure you're familiar with it if you've ever had an eye test in the past. If you could remain standing where you are, try not to lean forwards or anything. I just want to make sure that we get the correct distance between yourself and the eye chart, okay? So to begin with both of your eyes open, could you read for me please this letter? Very good. Now this one. Great. 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 Good. 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 Are you able to read any of the letters on this line here? Yeah, you want to give it a go? How about that one? Yeah. Good. 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 struggled to see. That's absolutely fine. That's to be expected. The last two lines here of a greater than 20/20 vision, so that would be above average eyesight. Just really quickly, whilst I have you with both of your eyes open, can you tell me what this colour here is, please? Very good. And what about this colour here? Very good, thank you. Now, if I could get you to cover just one of your eyes, please. That's excellent. And I'm going to be pointing to random letters now. And if you could tell me, please, the letter. So we'll start with this one here. Very good. This one here. Good. 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 Any on this line? How about this letter here? Bit of a struggle. How about this one here? Bit of a struggle. And then none on this line now. Okay, that's absolutely fine. If you could uncover that eye and switch to covering the opposite eye now, please. Okay. Exactly the same thing again. Can we do this letter here, please? Good. This letter here. Good. This letter here. Good. This letter. Good. This letter. Good. 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 How about this letter on this line? This letter. Good. This letter. Good. Any letters on this line here? Okay, and with that eye closed, you obviously already know these colours, but can you see this colour as the same as before? And the same for this one. Excellent. If you want to just really quickly switch back to covering the other eye for me, how do these colours look for you now? They look the same. Yeah, very good. Okay, you can uncover your eyes there. It looks like the one eye is slightly stronger than the other. There is a slight variance in the ability of your eyesight, of your vision between the eyes. So I'm going to be investigating that a little bit further now. Okay, so for this next section, I want you to keep your head still and to keep your eyes focused on my nose. I'm going to be looking more at your peripheral vision for this next section, okay? So I'm going to flash up a number of fingers and I want you to tell me how many fingers I'm holding up. Okay, so we'll begin that now. Here we go. Good. 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 Very good. Good performance there. Okay, and a very similar thing. I want you to keep your head still focusing just on my nose. I'm going to hold my fingers up like this, and I'm going to wiggle one or the other, something like this, possibly both. And I would like you to tell me, please, left, right, or both, whichever fingers I'm currently wiggling. Okay, so we'll begin that now. Good. 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 sort of mark the edges of your peripheral vision, so to speak, just to make sure that you have a good range of peripheral vision. So for this, you'll be doing the exact same thing, as in keeping your head still, focusing on my nose. I'm going to hold my fingers something like this, and I'll be moving them apart in various different directions, and when they leave your field of vision, I want you to let me know. Okay, we'll begin that now. Here we go. Good. 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 Okay. Here we go. Good. 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 There we go. That looks excellent. Okay, so I'm now going to hold up my finger in the background here, and I'm going to hold up my other finger close to you here. In fact, I'm going to use a pen just to differentiate the objects, make it a little bit easier. So I'll have my finger in the background here and the pen up quite nice and close to you here. Okay, so to begin with, I want you to focus on the on my finger in the background, and then when I say switch, I want you to switch your focus to the pen in the foreground closer to you. Okay, so starting with focus on my finger, switch, switch. Okay, I just want to change their locations a bit. There we go. Starting this time with your focus on the pen in the background. If you could switch, 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 switch. Okay, that's very good. I'm just looking at your pupil dilation and your ability to focus rapidly, to rapidly change focus. I'm just going to quickly take a few notes, if I may. I just need to make sure that I remember some of the more crucial observations that I've made so far today. So far looking very good. Yeah, no major problems, I would say. We'll be looking at the difference in strength between your eyes. It may be that we need to look at glasses and prescription lenses just to help your eyesight a little bit, but we have yet to determine if that's necessary. Okay, thank you for your patience there. I just need to make sure I write everything down so that I don't forget everything. Okay, so now I'm going to turn the lights off in the room. It's going to get very, very dark indeed, and I'm going to be using a light pen to do a few varying tests with you, with your eyes, and how they react to darkness and light, etc. Okay, so I'm just going to turn the lights off now. Don't be too afraid when it does get very dark. Okay, so I'm going to be coming up quite close to you during this section. I hope that's okay. This is just to allow me to better observe your eyes, how they're behaving and how they're responding to the light coming up. Feel free to blink as much as you need to, of course, but I am trying to observe your eyes and how they behave, so try not to blink too excessively, if you know what I mean, but by all means do be comfortable and do let me know if it's a little bit too much at any point, and if you need a quick break, that'll be absolutely fine. Okay, so I'm just going to come a little bit closer to you now. I'm going to turn on the light now. Okay, so here we go. Very good, and I'm just observing now how your eyes respond. For this, I just want you to keep your focus on my nose, please. Okay, very good, very good, very good. Coming in a little bit closer with the light. Hope that's not too intense for you. Okay. Just going to switch over to the other side now, if I may. Okay. And how is this actually feeling for you? Are you feeling very discomforted? Are you feeling any pain? No, not too bad. Okay. Okay. I know this part is a little bit boring for you probably, but I am just making a few essential observations just to make sure that your eyes are behaving correctly as we would expect them to. Okay, so for this next part, I'm going to actually need you to follow the light as I move it around, but only with your eyes. So keep your head still, if that makes sense, and then use your eyes just to track the light. That makes sense? Yeah, excellent. Okay, so we'll do that now. If you could follow the light for me now, with just your eyes. Perfect, perfect. Okay. Very good. Very good. Okay, just coming in a little bit closer. Still following the light there. Okay, if you could keep your eyes upwards for me. I'm just observing the whites of your eyes. If you could keep your eyes looking down to the light now, yeah, very good. Okay, I'm going to move them to the side now, if that's okay. Very good. And going to move them to the other side now. Just focusing on the light. Okay, going to look at the corners very quickly just to see if there's any differentiation there. Okay, that was excellent. Take a minute to blink a few times if you need to. Rest your eyes. Okay, so now I'm going to put my hand along your nose, and this is going to effectively split your vision in half, so to speak. And now I'm going to be applying a light into just the one of your eyes. And I'm going to be observing the focus of your eyes. When the light is applied to just the one eye. Okay, and now I'm going to be doing the exact same thing, but with the other eye. Okay. the same way, even when the light is only applied to one of your eyes, if that makes sense. Okay, I'm very happy with what I'm seeing there, with what I'm observing. I'm sorry if that was a little bit intense for you. I know that's a particularly difficult one for the eyes. Things can get a little bit blurry and watery for your vision, so again, please take a moment to blink as much as you need to rest your eyes. And now for the final part of this dark room test, we're going to be looking at the focus of your eyes once again, very similar to the previous test, except this time I'm going to be having my finger nice and close to you, and this time a light in the background. We'll be switching their positions as well later on, but for now, if you could please focus on my finger to begin with. Very good. And if you could switch focus to the light. Very good. Switch focus. Good. Switch. Good. Switch. Good. Switch. Good. Switch. Good. Switch. Good. Switch. Good. Okay. Just going to be changing their positions now so the light is very close to you and that my finger is far away in the background. Okay. And if we could begin with focusing on my finger, please. That's excellent. If you could switch focus to the light now, please. Very good. Switch. Good. Switch. Good. Switch. Good. Switch. Good. Switch. 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 Okay, there we go. I'm very happy with what I'm seeing there as well. So I'm just going to pop the lights back on now. Okay, that's excellent. Thank you very much for performing so well during all the tests today. We've actually finished everything that I need to do. And very quickly, I just want to also write down the final observations I made with your eyes during the light portion of today's eye exam. Okay, so what I'm going to do is I'm going to pass along the information that I've gathered today to your optician, and they will know a little bit more regarding your eye health than me. I'm more of just a general practitioner, general doctor, but from what I can see, there is absolutely nothing to be concerned about. You do have that slightly stronger vision in the one eye than the other, but it almost seems negligible. There's probably no real need for prescription glasses. That's probably something for you to discuss with your optician. You could of course go for glasses and then they can get them fitted, do a very quick test to see what strength of lens you would need. But the improvement you would get from those glasses, in my opinion, would be almost negligible in your day-to-day life. For example, you certainly wouldn't need those glasses for driving or for reading or any activity like that. It would just be a slight improvement, but obviously it's something to take note of, and you may want to get your eyes tested once every 6 months just to be sure that the eyesight in the one eye doesn't deteriorate further. If it does, then glasses will be more of a realistic option, I think. But for now, everything is looking very good. Yeah, very happy with the results. Very happy with your performance during today's eye exam. Thank you very much. Any questions you might have for me? getting